right, so in a change of plans, I'm gonna go and well, most of you know me, but I'm Kat McDonough, PGY3, and I'm doing a lecture today as part of the admin and policy series. Doing a little bit different from typical admin lectures. I want to talk about an overview of healthcare reform in the United States. I think it's important for physicians to have an understanding of healthcare legislation and reform efforts because of how it greatly impacts our patients, and that we have a duty to support policies and politicians that are working to legislate in the best interests of our patients. All right, so first I'm gonna give an overview of the current structure of the U.S. health insurance system. Then we're gonna talk about some key components of the Affordable Care Act. We'll talk about some more recent legislation since the Affordable Care Act, and then what the next incoming administration may look like and bring for healthcare reform. By the end of the lecture, I hope that you understand the overall structure of the U.S. health insurance system, understand key components of the ACA and what it accomplished, and recognize recent and current healthcare reform legislation and future policy proposals and how it may impact healthcare. So as many of us know, health insurance is an important factor that contributes to health outcomes. We know that lack of insurance is one of the largest barriers to healthcare access. Lack of health insurance leads to out-of-pocket costs that may cause individuals to forego care, including preventative care. It leaves adults and children less likely to receive preventative services and medications for chronic conditions, and disparities in coverage contribute to disparities in health. It's really important in this country because healthcare here is extremely expensive. So we spend more than any other nation, including any other high-income nation, on healthcare. In 2022, the U.S. healthcare spending reached 4.5 trillion total, which came out to about 13,500 per person. By comparison, the average cost per person in other wealthy countries is less than half as much. And so you see on the graph here some comparisons up to 2012 and how we really started skyrocketing from other countries around 1980. Despite all the spending that we have in this country on healthcare, we have really terrible health outcomes. So compared to the other high-income nations in the world, we have the worst health outcomes overall. We are more likely to die younger, die from avoidable causes than residents of peer countries. These graphs show the US in the red dot compared to a number of other countries in the blue dots, showing how the US ranks in healthcare spending per capita and different health outcomes. So we have one of the lowest life expectancies, definitely the lowest of all other high-income nations, some of the highest obesity and diabetes rates, the highest maternal and infant mortality rates, as well as very high suicide rates. So all that money that we were spending is clearly not paying off. Also, compared to other countries, we are the only high-income country that lacks a form of universal health coverage, meaning that we are the only high-income country where a substantial portion of the population lacks any form of health insurance. 69% of the world has a form of universal health coverage, meaning that the government pays for your healthcare coverage. And all high-income countries in the world guarantee government or public health coverage for all of their residents. This map here shows countries in the greenish turquoise color that have free and universal health coverage, countries in purple that have universal coverage but is not free, countries in yellow that have free but not universal health coverage, and then countries in red that have neither free nor universal health coverage. And so we see that the US falls in that category. So what does our insurance system here look like then? So we know that, in the US population, you're either insured or you're uninsured. If you're insured, you either fall under private insurance or public insurance. So private insurance, what we're talking about is commercial health and plans. And this includes obtaining commercial health plan from your employer, from individual or direct purchases through the commercial health plan, or now because of the ACA through the exchanges, which we'll talk about. Public insurance refers to health care insurance that's administered and paid for by the government, and the main components being Medicaid and Medicare, as well as some other public health insurances like those for the military. So let's look at this a little bit closer. As many of you know, Medicare is federally funded and run for Americans 65 or older, and it really includes four main parts. There are two ways to obtain Medicare in this country. So the first way is through original Medicare. So original Medicare refers to having Part A coverage, which is hospital coverage, and Part B coverage, which is medical coverage. Many people also opt into Part D coverage, which is prescription drug coverage. Alternatively, and so original Medicare is run by the government. Alternatively, you can get Medicare Advantage, which is a Medicare approved plan run by a private health insurance company, and it offers an alternative to the original Medicare. It usually bundles parts A, B, D, and tends to have some other benefits as well. Just notably, people with original Medicare, so Part A, B, tend to have more options for providers. You can see any provider that takes Medicare, whereas if you have Medicare Advantage, you're restricted to in-plan networks. Also, if you have original Medicare, you do not need referrals to see specialists, but in Medicare Advantage, you do. The other forms or more common forms of public health insurance are Medicaid and CHIP, or the Children's Health Insurance Program. So these are both programs that are administered by states and funded both by the states and the federal government, providing matching funds. They provide free or low-cost medical care for low-income populations, but differ in a couple of key important ways. So Medicaid really provides broader coverage. It covers low-income adults and families living below certain income requirements. Medicaid covers 1 in 5 people living in the United States, 4 in 10 children, and 8 in 10 children in poverty. The CHIP, or Children's Health Insurance Program, provides coverage for families who fall outside of Medicaid eligibility, but cannot afford private insurance. And some states have expanded CHIP to include pregnant women as well. Then if we turn to our private health insurance sector. So the private health insurance sector is the main way majority of Americans access their medical care. Unlike many other nations, the U.S. relies on voluntary private health insurance as the primary source of coverage for residents who are not elderly, poor, or disabled, because then they would qualify for Medicaid or Medicare. Private health insurance is covered either through your employer or purchased directly by individuals and families. And as we see here, there are many, these are some of the most common ones, but many different health insurance companies in this industry. And they make a ton of money. They are extremely profitable. So this graph shows the revenue in billions of US dollars for the leading health insurance companies in 2023. Of note, United Healthcare made over 20 billion in profit. Cigna made 6.7 billion, and CVS Health made 4.2 billion in profit. They also, because of this, have incredible lobbying power. So in 2023, the insurance industry also spent 157 million on lobbying, which is the third highest amount of any industry. And this allows the health insurance companies to keep a decent hold on our politicians and be protected by our politicians. So when we look at how it looks in the United States, so now, and we'll talk about this, but after the Affordable Care Act, we have some record lows of uninsured. We have 8% of the population that is uninsured as of 2023, and 92% of individuals have health insurance. Like I said, majority of people have private insurance through an employer-based health policy plan. And then about 36% of the population has a public plan, about evenly split between Medicaid and Medicare. These other TRICARE and VA are like military healthcare plans. So there's a long history of efforts to reform healthcare in this country. We have a very different structure than other countries, and there have been many efforts throughout history to create mass reform, only a few being successful. I also want to point out that there have been many, many efforts throughout modern history to create universal health coverage, the most recent being in the 1990s by Bill Clinton, but none have ever been successful. So I'm going to point out a few key points in history that have brought us to where we are today. So health insurance as we know it really started in the 1930s and 40s when the Great Depression and World War II made employers offer health insurance coverage for wage controls placed on employers and to try to attract people into the workforce. 1960s are when Lyndon Johnson, specifically 1965, signed into legislation that established Medicaid and Medicare, which became the two largest government-sponsored insurance programs, as we talked about. The 1980s, under President Reagan, saw efforts of broad sweeping deregulation, and that included in the healthcare industry. This is the point at which healthcare insurance companies and hospitals started operating like businesses, with really the goal to maximize profits. And this is also the point at which the US started to diverge from the healthcare spending from other countries. It's really when our spending skyrocketed. And then about 40, 50 years later, we have finally another successful effort to reform healthcare, which was the Affordable Care Act, or the ACA, which was signed into law in 2010 by Barack Obama, and served as the most important effort for healthcare reform since Medicare and Medicaid. So now let's look at that. So often called Obamacare, the purpose of the ACA, the Affordable Care Act, was to expand coverage throughout the US by providing access to insurance coverage at more reasonable and affordable rates. It's a very lengthy and detailed piece of legislation, and it has a lot of nuances. It's definitely imperfect. So it's impossible to cover everything, obviously, in this short time. But I'm going to talk about some key things that the ACA did accomplish. So one of the most important things that the ACA did was provide a number of consumer protections and market rules that did not exist prior to the ACA. So I'm going to talk about three of them. One of the first things the ACA did was made it illegal for health insurance companies to deny or charge you higher costs based on pre-existing conditions. So before the ACA, there were a number of pre-existing conditions that would either keep you from being covered in health insurance or have you pay more. This could include anything like your age, your gender, or just being pregnant. Pregnancy was a pre-existing condition. And so the ACA made it so that no matter your age or any other, or gender, other individual characteristics, disease states, you could be covered by insurance and not have to pay more. One of the other important things it did was require that all health insurance companies, in accordance with the ACA, cover 10 essential health benefits. And this included a number of free preventative care services, which we'll talk about in the next slide. There could not be an annual cap or lifetime cap on the amount of money the insurer would pay for these services. And then third, another really important thing the ACA did was allow young adults to stay on their parents' health insurance until age 26. Prior to the ACA, you could get kicked off your parents' health insurance at 19. I know that many of us in the room, the norm for our lives has been to have health insurance coverage through age 26. And that is really thanks to the Affordable Care Act. So just going back to the essential health benefits that the insurance plans must offer. So the ACA defined 10 essential health benefits that all insurance plans must cover and cannot charge annual or monthly caps on spending for this. So it included all the things listed here. I think one of the most important things that it did was include a number of preventative services that they had to cover without charging you a co-payment or co-insurance for these preventative services. So preventative services listed under this include different cancer screenings, different chronic disease screenings, infectious disease screenings, all immunizations that are recommended, birth control, and a number of other services for women and children at no cost to them. So turning to another really significant thing that the ACA did, it expanded Medicaid. This was one of the most impactful provisions of the ACA. It expanded the eligibility income requirement for those who qualified for Medicaid. Initially, this was supposed to affect all the states. However, a 2012 Supreme Court ruling brought on by Republican leaders had the Supreme Court rule that the expansion is optional for states. So as of February 2024, 40 states and DC have expanded Medicaid, and 10 states have not, as shown on this map. So blue is expanded and green is not. So let's look at what expansion of Medicaid really means. So Medicaid eligibility is dependent on where you fall relative to the federal poverty level. The federal poverty level is set by the government and is defined as the minimum amount of gross income that is needed for essentials. This includes food, transportation, clothing, and shelter. These are in 2024, the federal poverty levels divided by how, like whether you fall 100% of the federal poverty level or onward. Prior to the ACA, as a non-elderly adult, you would qualify for Medicaid if you made less than 100% of the federal poverty line. This was a little bit more generous for children and pregnant women who were eligible if they made 138% or 133% of the federal poverty line. But for everyone else, that meant that if you were in a household of one in 2024, for example, without the ACA, you would only qualify for Medicaid if you made less than 14,500. States could actually set this to be lower. And so the exact percentage of the federal poverty line or level used for eligibility purposes varied based on the state. So before the ACA, the median pre-ACA income eligibility limit for adults was 64% of the federal poverty line, so even less than this. The ACA said that, these incomes are not covering enough people, and so we're going to expand Medicaid eligibility to 138% of the federal poverty line. So the ACA expanded it to 138%, and so that meant that your eligibility as one person in 2024 increased from making 14,500 to 20,000 and onward. Because it's not required to expand Medicaid, there are still, like I said, 10 states that have not expanded Medicaid. And this means that the median eligibility for adults in these states that have not expanded Medicaid is 38% of the federal poverty line. So this means that these are the states with the lowest percentage of the federal poverty line for Medicaid eligibility, and then the highest in the states that did not expand. And so, for example, in Texas, you have to make 16% of the federal poverty line or less, which comes out to about 3,600 annually in order to qualify for Medicaid. So that's a really low amount, and you can see how many low-income people are not covered by Medicaid without the expansions. This also leaves out a number of still low-income people who fall above the eligibility guidelines for Medicaid, but still may not be able to afford private health insurance. And so that is where the marketplace exchanges and their subsidies came in. So what is the marketplace? So the ACA established this health insurance marketplace, also known as the exchanges, which helps people enroll in a commercial health plan who do not qualify for Medicaid or Medicare and who do not have an affordable offer of coverage from an employer. So all those people that are left out between Medicaid eligibility and being able to afford either private insurance through their employer or a direct purchase. The marketplace offers a choice. You can search, compare, learn about different health plans and pick a choice of a health plan. And it also provides different financial assistance for health insurance coverage. How it works is essentially all of the marketplace plans, which again are commercial health plans, have to offer the same essential health benefits, which we talked about before. How they differ is their payment schemes. So plans on the marketplace are grouped from these different metal levels. One spectrum being the platinum level, which means that you pay the highest premium costs, so the highest monthly costs. But when you access care, you pay the lowest out-of-pocket costs. So that spectrum of the metal plans, the premium, is ideal for people who intend to use a lot of healthcare services, but want to pay less each time that they do in exchange for a higher monthly premium. Alternatively, the bronze plans on the other side of the spectrum, you would pay the lowest monthly premiums, but every time you access care, like see a doctor or get medication, you would pay higher out-of-pocket medical costs. So these are ideal for people who do not need to use a lot of healthcare services. And then there's a spectrum of people that fall in between. And so, like I said, all the plans in the marketplace have to cover the same essential services, but just how you pay is where they differ. The ACA created a number of subsidies to help people purchase these health insurance plans on the marketplace. So one of the more important subsidies is called the premium tax credit. Premium tax credit is available to individuals and families with income incomes at or above the federal poverty level, so ranging from 100% of the federal poverty level to 400% of the federal poverty level. And it's only for people who purchase health insurance on the marketplace. The amount of your tax credit is based on a sliding scale, which is dependent on income, with generally greater credit amounts available to those with lower income households. So this really tried to encourage people to buy on the marketplace who could not get care otherwise. I just want to touch that also ACA did a number of things for Medicare and kind of rewriting how Medicare worked. So it did things like eliminate the prescription drug donut hole, which left a lot of Medicare enrollees required to pay out-of-pocket costs for their prescription drugs. It also incentivized creating chronic disease kind of management programs with greater dollar reimbursements to providers whose patients were in these programs. Payments were also increased to primary care providers who provided a greater share of Medicare patients in their practice. So it did, while there's a lot more detail we could go into, I just wanted to mention that it did do some things for Medicare as well. So let's look at what impact this had. So one of the main objectives of the ACA was to drive down insurance rates, and it has indeed been, or drive down uninsured rates, and it has indeed been very successful in this. So we saw the first drop in uninsured rates from the passage of Medicare and Medicaid in 1965, and then the next major drop was when the ACA was enacted. Before the ACA was enacted, 14 to 16% of people in the US were uninsured across all age groups, and by 2023, the uninsured rate had fallen to a record low of 8%. And this is true across all age groups. So while disparities in healthcare insurance coverage still vary, all age groups saw a drop in their uninsured rates as a result of the ACA. Medicaid expansion became one of the most important predictors for how many people remain uninsured in a given state and the disparities in insurance rates between states. So this graphic here shows from 2013 to 2015. 2014 is when the ACA was fully implemented. And so this shows purple is rates of people who are uninsured. The black outlined states here are the states that expanded Medicaid right away in 2014, and we see that in those states, they had the highest decrease in uninsured rates compared to the states that did not expand Medicaid. The ACA has also become very popular in recent years. So initially, it was, pretty unpopular, and then over time, as it's become kind of the norm and a standard way of our healthcare system, it's become a lot more popular with majority of Americans having a favorable view of the Affordable Care Act. There's also some data to suggest that the growth rate of healthcare costs is slowing since the ACA was enacted, with a 3.6% growth rate between 2010 and 2018, which is lower compared to the prior decades. However, the ACA is still very much imperfect. Its health insurance is still extremely expensive. Prescription drugs are extremely expensive, and many people still have difficulty accessing care and medications. So let's look at a couple pieces of more recent legislation that have attempted to expand healthcare access and coverage even more. So like I talked about, the ACA, wow, a whole group. The ACA established financial assistance through the premium tax credit. The 2021 American Rescue Plan and the 2022 Inflation Reduction Act expanded the premium tax credits that we talked about to cover a larger share of enrollees. So with these enhancements, more people are eligible for marketplace subsidies, and more people are eligible for very low costs of their health care plans through the marketplace. With these new enhancements of the tax credits in 2021 and 2022 through these new legislation, 74% of enrollees on the marketplace qualify for paying less than $10 per month for their healthcare coverage, compared to before these enhancements, only 31% qualified to pay $10 or less. This has meant that the marketplace enrollment has skyrocketed since these premium tax credit enhancements began in 2021. And we see now that tens of millions of Americans are relying on the marketplace and their enhanced premium tax credits for their health insurance. We also, another problem is that prescription drugs still cost way too much. So while the ACA contained a number of provisions to alter prescription drug access and affordability, it stopped short of instituting systemic changes in the pricing of drugs. Pricing of drugs has become an increasing challenge for Americans, despite your health insurance coverage. And per capita spending on prescription drugs continues to increase that year and is actually outpacing inflation. One of those drugs whose prices have skyrocketed is insulin. So this graph shows the percentage change of cost of insulin over the last couple decades. And we see that the percent change in cost of insulin has skyrocketed compared to a number of other goods, including college tuition, childcare, housing, et cetera. And it's uniquely a United States problem. So our average price per standard unit of insulin is way more than other countries are paying for insulin. So clearly this is a problem with how many of our patients have diabetes. So the Inflation Reduction Act, another thing that it did which was passed in 2022, was to cap the monthly cost of insulin for Medicare enrollees at $35 per month. This is going to lead to some good savings for Medicare enrollees, but again, it's only for Medicare enrollees. It does not cover private insured patients. The Biden administration wanted to include a provision that included privately insured patients, but this was stripped from the final legislation after Republicans voted to remove it. Another thing that the Inflation Reduction Act of 2022 did was enable Medicare to negotiate drug prices for the first time in history. So because of a 2003 law, Medicare was prohibited from negotiating drug prices with pharmaceutical companies. But now because of the Inflation Reduction Act, they can directly negotiate for lower prescription drugs. So the first phase of this new legislation picked 10 of the most commonly prescribed drugs in the Medicare population and the most expensive drugs. And just recently, in the last few months, released these new negotiation prices. And so you'll notice a lot of these medicines we are very familiar with. And so the Medicare has now negotiated significant decreases in their cost. Again, this is only for Medicare patients. The Inflation Reduction Act also capped all Medicare Part D enrollees oh, sorry, ignore what I was going to say. So anyway, so it reduced the price of all these drugs, but just for Medicare patients. But they are the more common population that use these medications. So lastly, I just want to talk about kind of what we might be able to expect next. Obviously, we're having a change of our administration and a change of maybe our perspective on healthcare insurance and what it should look like in this country with the new incoming administration. So let's look at what we might come to expect from the next administration. So when asked at the presidential debate if he had a healthcare plan, we'll remember that President Trump said he had, quote, concepts of a plan without being able to elaborate on what that meant. He also claimed many times that he, quote, never thought about repealing the ACA. However, in 2017, his administration tried to repeal the ACA, only failing because of the downvote of a few Republicans, most notably John McCain. And so this was a big priority of his last administration, but was unsuccessful in repealing it, partly because of how many people it now covers and how popular it is. He's also mentioned still in this election cycle, wanting to get rid of the Affordable Care Act. He has been outright in saying what he wants to do, which it's not really clear to me what terminating it means, terminating Affordable Care Act and replacing it with something better means. He has not really elaborated on what that would mean. However, the Republican proposals, including budget proposals, as well as Project 2025, have outlined their plans for health insurance policy under their leadership. And so one of the main things that they are calling to do is to make additional cuts to Medicaid, which would, in result, take away significant portions, millions of Americans' healthcare coverage who have benefited from the Medicaid expansions and received their care through that. Also, the ACA marketplace, which we've talked about a little extensively now, covers about now 20 million people, with 9 in 10 of them using these premium tax credits in order to afford it. And the Republican plans have outright called for ending the premium tax credit enhancements that have allowed so many people to obtain coverage through the marketplaces. The premium tax credit enhancements are set to expire in 2025. So without congressional action, many people will lose the affordability to purchase health insurance through the marketplaces. This means that many people, it's just going to be too expensive on the marketplace. And the marketplace served as kind of that middle portion for people who didn't qualify for Medicaid and who also couldn't purchase private insurance directly or through their employer. So this graph shows kind of the increase in annual premiums, dependent on the federal poverty level you're at and your income, and what families, this is showing family of 4, what increase in their annual premiums they may expect to see if the premium tax credit enhancements are not continued. Also, Trump administration has selected Dr. Oz as nominee for Centers of Medicare and Medicaid. And this is really important because on his show, he repeatedly touted Medicare Advantage. He's a big proponent of Medicare Advantage, which, as we remember, is a means of obtaining Medicare through a commercial or private health insurance plan. Disclosures later showed, when he ran for his Pennsylvania Senate seat in 2022, that he owned $600,000 of stock in the 2 largest Medicare Advantage sponsors, United Health and CVS Aetna. So Dr. Oz has been open about wanting to privatize Medicare, meaning pretty much get rid of the original Medicare and make everything through Medicare Advantage, which would not only financially benefit him. If the original Medicare were to go away, the stocks for Medicare Advantage would soar and he would financially benefit. But Medicare Advantage has also has shown a number of problems, which are why many people still want original Medicare to exist as well. So Medicare Advantage, in practice, like we talked about, restricts choice of doctors and hospitals. They have higher rates of denials and prior authorization requirements than original Medicare. They've been found to engage in illegal upcoding. And it's estimated that Medicare Advantage will cost does cost a lot more than original Medicare, about 22% per enrollee more than original Medicare, and that Medicare will pay Medicare Advantage plans at least $83 billion more than it would have paid to cover the same enrollees under the original Medicare. So Dr. Oz in control of the Centers for Medicare and Medicaid, we may see the end of Medicare as we know it, at least in terms of what he's been talking about wanting to do. So I know that this is a huge topic, a lot to cover in just 30 minutes. And I know, sorry, I went a little bit over time, but I did just want to kind of give an overview of what healthcare policy looks like in this country, more recent legislation, and what we might expect to see in the next 4 years. I hope that you came away with an understanding of where we fall compared to other nations in terms of our healthcare policy, what impacts the ACA had, and then what more recent legislation has done to try to reduce prescription drugs and marketplace premiums. And that's it. And there's my feedback link.